Let's talk about the cranium. When you talk about the cranium, you have to talk about the skull bones as well as the joints that interconnect those bones. The joints that interconnect those bones are considered immovable. They will be what is known as synorthotic, and we'll talk more about that when we get to articulation, so don't panic. They are also joints that will be connecting bones through fibrous connective tissue. And you remember there's a lot of collagen in fibrous connective tissue. So there will be a lot of tensile strength associated with those fibers. The coronal suture will attach the frontal bone to the parietal bones. So if you can see my cursor, here's the frontal bone, here's the parietal bone. This is the coronal suture. And you'll remember that a coronal or frontal plane divides the body from anterior to posterior, so this suture is kind of anterior to posterior. The squamous suture is going to be right in through here. That will be mainly between the parietal bones and the temporal bones, right through here. And then there will be another, which is known as the lambdoidal suture, which is going to interconnect the occiput, this occipital bone, with the parietal bone and the temporal bone. The facial bones we'll go over in a little bit more detail, and this shows you several important landmarks, which include this guy, this hole. The word for hole, when you're talking about bone, is foramen, F-O-R-A-M-E-N. This is going to be the magnum foramen, which literally means big hole, because that is where the spinal cord exits the cranial cavity. This landmark in through here, which we'll talk about again, is known as the sella, S-E-L-L-A, turcica, T-U-R-C-I-C-A, turcica, Turkish saddle, gotta call it sella turcica, and that is where the pituitary will sit. And that just shows you the brain seated within the cranial cavity. I like this because it shows you some important cavities. Here's the cranial cavity, and again, this is going to be a frontal plane. Here's the cranial cavity. These are the cavities for the eyes, also known as orbits. You will see the nasal cavity, and you'll see these sort of wing-like structures. Those are going to be what are known as conchi. There will be 3 pairs, superior, middle, and inferior, and we'll talk about the function of those when we get to that appropriate bone. And then you have, of course, the oral cavity, which is going to be formed by the maxilla and the mandible. We have a lot of holes in our head. We have sinuses, as well as the various cavities. Now, what do you need to know on this guy? When you smack your forehead in a classic, I could have had a V8 movement, that is the frontal bone. There is going to be a point that is just superior to the so-called bridge of your nose, which is known as the glabella. That's going to be an important landmark for doing radiation or imaging for the pituitary. So this is the glabella, this guy. So I would add that to your list of must-know landmarks, also because it's pretty cool. You will need to know, this is, you follow these lines in here, the ethmoid bone. This guy we already talked about a little bit, the inferior nasal concha. You will need to know this guy, which is going to be the sphenoid bone. See that sort of pink within the orbit? The lacrimal bone is this green guy here and here. They will be paired. And if you hear lacrimal, think tears. So you'll have a lacrimal apparatus, which is responsible for producing tears. We'll talk about that when we get to special senses, I believe. Here's the maxilla, and here is the mandible. This is anterior to posterior, this is posterior to anterior, so these will be the parietal bones, which you can kind of, oops, go back up, got overexcited. Here and here, the sort of darker pink, the parietal bones. So these are the parietal bones, which will be attached by what is known as the sagittal suture. This is the occipital bone, and this is the lambdoidal suture. Lambda is Latin for L, and they kind of thought this looked like an L. Good for them. Mastoid process is going to be one of the must-know landmarks, I believe. And these will be the temporal bones right in through here. So this is going to be a lateral view. Here's the occipital bone. Here is our parietal bone, frontal bone, temporal bone. This is going to be the zygomatic process right in through here. Sorry, the zygomatic arch. Let me correct that. Zygomatic arch, which gives you your cheekbones. This is the external auditory or acoustic meatus. That's the hole in your head for your ear. You have one on each side now, bilateral. Mandible, of course, and the maxilla right in through here. And you can see the lacrimal bone tucked away. This guy will be the part of the sphenoid bone. The sphenoid bone is going to be an important bone because it's considered the keystone of the skull. Every skull bone will attach to it one way or another. Pretty cool. This just shows you a skeletal view. Here's our occiput. Here's the lambdoidal suture. This is going to be the parietal bone. This is the frontal bone. Here is the zygomatic arch. This will be the zygomatic bone. Here's the maxilla. Here is the mandible. Here are your teeth. And right in through here, you can see the tiny little nasal bone. And the lacrimal bone is tucked right up in through there. And you can kind of sort of also see the ethmoid bone. This will be part of the sphenoid bone in through here. So coronal suture and lambdoidal suture. And this guy, which you can very, 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 very faintly see, is the squamous suture. I know I'm buzzing through these really quickly. So this is a mid-sagittal section. And we've seen a lot of these already. So let's go through them again. Occipital bone, parietal bone, frontal bone. There are going to be sinuses, which are cavities within certain bones. Here's the frontal sinus. This guy is going to be the sphenoid bone, the sphenoid, right in through there. Here is, this guy is going to be part of the temporal bone. This is the sella turcica, which I mentioned, that Turkish saddle, which houses the pituitary. This is a vomer, which we have not mentioned before. Here's our ethmoid bone. Here is our nasal bone. This is the maxilla. And this is the mandible. This suture will be the coronal suture. This cut is along the sagittal suture. This in through here is the lambdoidal suture. And what else do we need to know about? I think that's it on this. Oh, actually this guy right here, if you scratch on the back of your head, there's going to be a big bump there. That will, whoops, go back. Very exciting. External occipital protuberance. That's that bump on the back of your head. This is an inferior to superior view. So basically you're looking at the most inferior aspect of the skull. Here is the occipital bone. Let's do some landmarks here. Occipital bone. This guy right in through here is going to be the what? That's going to be the what? Temporal bones. Here is the lovely zygomatic arch. This will be the zygomatic bone. This is going to be part of the maxilla. Pink one right in through here will be the, anyone guess it? Sphenoid. Here's that giant hole, the foramen magnum. These guys, these little rounded processes, which are known as condyle, C-O-N-D-Y-L-E, are the occipital condyles, and this is where the occiput, the base of your skull, is going to actually articulate with your first cervical vertebrae. This is where your skull will articulate with your first cervical vertebrae, the most superior bone of your vertebral column. Mastoid process, here's one. Here's the other. Oh, and here's the external auditory or external acoustic meatus. Why is the mastoid process important? Because it will be a point of attachment for the sternocleidomastoid muscle, which we get to talk about in the next section. So when you look at bones, let's just pop up back through here and look at some of these landmarks. Let's look at the skull here, this cranium skeleton. You can see that the bones are not just basically flat like a desktop would be or a book. You'll see a lot of hills and a lot of valleys and a lot of ridges. So why might we have all of those? Because if you look at any bone, whether it be a long bone or a flat bone, they're going to have these sort of contours to the bony surface. So think about why we might have those contours on those bony surfaces. Let's talk about that in a minute. Put that in your hopper and see what comes out. See what percolates up. Shows you the same view, except on a skeleton. It's the occipital bone. Here's the foramen magnum. This is going to be, these will be the occipital condyles. Here is the mastoid process. They will be bilateral. There'll be another one here. What else do you need to know? Oh, right, zygomatic arch, very nicely imaged right here. And this will be a hard palate of your mouth, so that these will be part of the maxilla. I think that's it on this guy. So this, the calvarium, the top of the skull has been removed. And let's talk about this a little bit. Again, occipital bone. You are looking from the inside of the skull down inferiorly. So occipital bone, foramen magnum. The parietal bones will be in through here. This guy is going to be, these sort of orangey ones will be the temporal bone. The pink one will be the sphenoid bone, you got that. Here is the sella turcica again. Now there are a couple of important landmarks that we'll talk about in a little bit, but let's introduce them here. The cribriform plate and the crista galli, right in through here, they're going to be part of the ethmoid bone, and this guy will be the frontal bone. There are a whole lot of other landmarks. It would be great if you know, but they are not required for this class. So if you see all these other landmarks, you want to go ahead and learn them. Excellent. They are not required for this class. Shows you the same structures except on a cranium, foramen magnum. So this will be the occipital bone. And through here will be the sphenoid bone. This is the sella turcica, frontal bone here. Right? We talked about the cribriform plate and the crista galli of the ethmoid bone. And temporal bone through here and through here. You can just see a sliver of the parietal bones. So this shows you the temporal bone right here. This will be the zygomatic process of the temporal bone. There will be a temporal process of the zygomatic bone, but really all you need to know is that arch is known as the zygomatic arch. Here's the mastoid process. There's going to be another long, spiky process. If you know what a stylus is, it's what people, it was only years ago, not so long, but in the olden days used to use. They used to use styluses to write. Stylus to write. Here is the external auditory external acoustic meatus. Meatus means canal. So sure enough, sound waves will travel through that, hit the ear ossicles, which will vibrate and make various membranes and fluids move, which is how we start to hear. This is the sphenoid bone, and I like to call it the bat bone or the moth bone because it kind of looks cool. Very excited. It has various parts. greater wing. If there's a greater wing, what a surprise, there has to be a lesser wing. But really, the major landmark that you need to know about or of the sphenoid bone is this guy, which is the sella turcica, that saddle in which the pituitary sits. So this will be the ethmoid bone. And you'll see the crista galli, which is marked, and the cribriform plate. And these guys are going to play important parts with regards to your sense of smell and olfaction. This is the perpendicular plate, which is going to help start to divide the nasal cavity into right and left. This is going to be the middle nasal conchae. The conchae are going to be important. There'll be an inferior conchae, nasal conchae, there'll be a middle nasal conchae, and there will be a superior nasal conchae. Their job is to increase the surface area of the mucous membranes in the nasal cavity. Their job is to increase the surface area of the mucous membranes in the nasal cavity. Those mucous membranes are going to be important, or that increase in surface area will be important for a couple of reasons. One, because it allows there to be more exposure of surface area to trap particulate matter and dust particles in the mucus, which is cilia within your nasal cavity, will sweep back to the back of your throat, so you swallow it and it passes harmlessly through your system before those particulate matter and dust particles hit your alveoli or move through your respiratory tract and hit your alveoli and get stuck there. And also because there is more surface area to warm air as it enters the nasal cavity and then the respiratory tract. You want that air to be nice and warm, particularly if you're living in a cold environment, so you do not damage those very fragile alveolar sacs and alveoli. This shows you a fetal skull, and the reason that we have this here is because you're going to see the fontanelles. Fontanelles are fibrous connective tissue. Remember that the bones of the skull are not fused when you are an infant. You do not want them to be fused because you kill the baby and you would kill the mother if you had fused skull trying to go through the birth canal. So these bones sort of end up overlapping as the fetus is pushed through the birth canal during labor. And the fontanelles allow for that. So the anterior fontanelle in particular is known as the soft spot. You will see that the frontal bone is not a single bone when the baby is born. And you will also see that the sutures are not formed. And again, that allows for the skull bones to overlap as the baby is born. Here's our friend the mandible. And there are a couple landmarks that you need to know. This will be the ramus of the mandible, and the one on each side, so they are bilateral. This is the body of the mandible. This is going to be an important joint. It is the temporomandibular joint. The mandible is the only freely movable bone in your skull. It allows you to chew and talk. This is a hyoid bone. The hyoid bone is unique because it is the only bone in the body that does not articulate directly with another bone. You have soft tissue and muscles attaching it. It's used for the attachment point of soft tissue and muscles. In the neck. This gives you an image of the eye socket, the orbital cavity. And there are times, on occasion, where I ask you to name, for extra credit, to name, on an assessment, to name all of the bones that form the orbital cavity. And you'll look them up. I'm not going to give them to you. But you will see that it is a complex structure with a lot of grooves and foramen, and it's actually pretty amazing what a great job it does in protecting our eyeballs. So you will see this is a section which shows you bones that are going to form the lateral wall of the nasal cavity on the left. The nasal septum has been removed. Fear not, I will not put something like this on an assessment and say, name all these bones. Let's see what we can find out, though. All right, so here's the sphenoid bone. This guy is going to be that little satellite structure, is going to be the sella turcica. This gives you a great job of the superior and inferior. Here's the superior nasal concha, here's the middle nasal concha, and here's the inferior nasal concha. Here's the nasal bone. This is going to be the maxilla. Here's the frontal sinus coming through there. And this just gives you some additional detail. Here's a hard palate. Here's the septal cartilage. Frontal sinus right there. We talked about the cristagalli and the cribriform plate. I'm going to go right into here. Here's our sella turcica again. The sphenoid bone also has a sinus, and there it is. And these are the sinuses which you need to know. These are required, okay? So there will be sinuses associated with the frontal bone, the ethmoid bone, the sphenoid, and the maxillary bone, so the maxilla. If you look at the gold standard for anatomy, which is Gray's Anatomy, there is a book, Gray's Anatomy. I know it is also a television show, but it's GRAY'(s) Anatomy. It is the gold standard for anatomy. If you look at Gray's, they tell you that really there's no absolute positive reason that we have sinuses. The best guess that they have are these. One, they lighten the weight of the skull, because if the sinuses were actually packed with bone, our skulls would weigh a bunch more than they already do. They also provide some ability to warm air as it enters the nasal cavity, depending on what sinuses you're talking about. They also help with voice resonance. So those are the three reasons that we are theorizing we have sinuses. One, to lighten the weight of the skull. Two, to provide additional surface area to warm air before it enters the respiratory tract. And two, to aid with voice resonance. Now, if you have ever been unfortunate enough to have a sinus infection or a sinus headache, what happens is this. If you have sinus infection, bacteria get into a sinus, and it's a great place to live, right? It's warm, it's body temperature, resources are there, and they're producing waste, and that waste clogs up the very small foramen that allow access in and out of the sinuses. Those get clogged up, and the bacteria start to use up whatever they can in those sinuses, including the air. So when that air gets used up, you end up with a vacuum in your head, which is why they are so unbelievably painful. Ow.